Welcome, everyone. We are so excited to have you joining us today. We thank you for joining us for this event regarding our high school to healthcare medical assistant training program for high school seniors. Center for Healthcare Careers is a healthcare workforce development organization in partnership with Aurora Health, Ascension Wisconsin, Children's Wisconsin, and Freighted Health. And we are so excited to be launching this pilot program that's been funded through a grant from Advancing a Healthier Wisconsin Endowment. I'm Kathy Karshna. I'm the Executive Director of the Center for Healthcare Careers. And joining me from the center is Jennifer Ditchite. She is our Marketing and Outreach Coordinator, and she is also going to be behind the scenes creating our PowerPoint and working to make this event go smoothly. If you have any questions during the presentation, we encourage you to ask them. Please put them in the chat, or you can raise your hand by clicking the React button at the bottom of the screen and then clicking the bar that says raise hand. We will have opportunities for you to ask questions during the presentation, and we welcome them. So speaking with you tonight are members of our partner health systems. And so without further delay, we are going to have them introduce themselves, and then we're going to be providing you with information about medical assisting and about working in healthcare.
Yes, I'll start out. My name is Kim Kwetschke, and I'm a Senior Talent Sourcing Specialist with Aurora Healthcare, and I'm really excited to be here today and see such a nice large group.
Hello, I'm Mike Vistano, the Workforce Development Manager for Ascension, Wisconsin. Really excited to talk to you all today. Thank you for taking the time this evening.
I'm DJ Hushek at Children's Wisconsin, and I'm a workforce development consultant. So thank you all for joining us here today for this presentation.
All right, I'd like to start out by, I guess it just helps us get to know the students a little better. If each of the students could put your name and what high school you're from in the chat. So just take your time to do that now. Oh, I love seeing such a variety of different high schools. That's awesome. All right. I think, is that about it? Thank you so much. All right, so I'm just going to touch on our agenda for today because we've got a lot of exciting things to cover. So importantly, we've got a real live medical assistant here to talk to you all today. And so that's what we're going to start out with. And then we're going to go into just talking about healthcare careers in general. So why would you want to work in healthcare? What's so great about working in healthcare? And then, you know, once you start your healthcare career, what's going to make you successful in working in healthcare? And then what are some common benefits of working in healthcare? And then, and then what are some of different types of work locations, you know, especially focused on medical assistants, of course. And then what are some common work hours that you could expect?
Kim, it looks like you might be on mute.
All right, am I back? Sorry about that.
Yep.
Okay. Okay. So I'm not sure if you heard this, but we're going to talk about the different types of work locations for medical assistant, and then just end by questions and answers. But of course, you know, as we're chatting, if any students or anybody who's joining has questions as we're going along, you know, we'll pause throughout. All right, so I'm excited to introduce Angelina Jean. Did I pronounce your last name correctly?
Yes.
Okay, great. And Angelina is an employee of Aurora Healthcare. And she's been a medical assistant for quite some time with us, which is really exciting. But I'll let you introduce yourself, Angelina, and talk
Hi,
a little
Robert.
bit about where you work at Aurora Healthcare and your years of experience.
So, hi, my name is Angelina Zhang. I work for Advocate Aurora. I've been with the organization for almost 11 years, and I've been a medical assistant for the past 6.
Awesome, thank you. So what we're gonna do is, there's a few of us that are gonna take some time to ask some questions of Angelina that'll just help you learn more about the career of working as a medical assistant. So let's see. Well, and actually that was the first question, so now we'll move on to Michael.
Hi, Angelina. Thanks so much for being here this evening. It's really appreciated. And thanks for sharing your journey and pathway with everyone. I'm sure it'll be very helpful. Could you share what interested you in becoming a medical assistant?
So, I started out working as a receptionist, checking in, checking out, scheduling appointments for patients. After 5 years of doing that, I decided I want to do more hands-on work. I see that, the medical assistants and nurses they bring patients back, they give vitals, and they work closely with the providers. And that was something that I wanted to do more, was to help patients out than just checking them in.
And
Thanks,
DJ.
Angelina. And could you just share with the students what a typical day or week looks like for you? What are you doing on a daily basis? And just paint a picture for them to see what a medical assistant is like.
On a typical day, you work with the provider. Some may start at 7 o'clock, some start at 8. Usually, a lot of the providers start at 8 o'clock. So you just get a look at your schedule. You may have about ranges between like 2 to maybe 20 patients a day. So what you do is I would call out the patient when it's time for their appointment, bring them back, get their height, weight, blood pressure, um, heart rate, and verifying their medications, allergies, kind of get them all ready for their doctor's visit.
Thank you.
Wonderful. So you've been a medical assistant for quite some time. So if you think about your journey throughout your career, think about what are the things that you most enjoy about your job on a daily basis?
I would say working with the providers directly one-on-one. When you bring back a patient, you ask them the questionnaires of, why are they here? You get their vitals. And then communicating with the provider kind of gives you that bonding and that support that the providers are looking for. So they are looking for like an assistant, someone who will kind of, you meet the patients first, and then you are pretty much relaying the messages to the doctor.
And so for students who might not know, when Angelina is talking about the provider is the physician.
Awesome. That sounds very, very rewarding. With that, what challenges do you find in your current role?
I would say a language barrier. I grew up speaking Hmong, and I would say my family doesn't speak Hmong. But a language barrier is one of the challenging barriers that we have in healthcare. A lot of we have interpreters nowadays, but there are a lot of languages out there that don't have a interpreter for, and they use family members. The only thing about utilizing a family member is there may not be a word in the language for a certain medical term. And it's hard to explain to the patient or the family member what it means. But a lot of them, I would say, we use interpreter services because they are more knowledgeable in the language, the medical language. So they do have a little more understanding of it. But I see that that is a barrier in challenge in today's.
Thank you.
So Angelina, could you share with the students about your career progression and what you think has made you so successful as a medical assistant?
So we have with Aurora, there is they have what is called a reimbursement program. So what I did was I decided to go back to school and I took a student reimbursement program where they pay for a part of your schooling. I went back to school, became an MA, and I was able to support Aurora with the job that they had helped me establish. I went back to school at Bryan and Stratton with for a 2-year program, but I was able to complete my whole degree in 4 semesters, so about a year. With the MA program, they also have what is called a MA ladder, where you can work your way up from a regular MA to an MA2, and then you can become an MA lead or anything. So there is a learning advantage within the program.
Thank you, Angelina. That's great to hear that you were able to leverage one of the benefits that Advocate Aurora offers. So we'll be mentioning that again later in the presentation about just how there's really great benefits working in healthcare. And then it's always great to hear when people start off in a job in healthcare and they're able to progress and advance in their career. So thank you for sharing your story. And then last question, Kim.
Mm-hmm. And actually, I've got just one more question for Angelina based on what she just shared. So I'm curious, while you went to school to become a medical assistant, were you still working in your receptionist position and doing schooling at the same time?
Yes, so I was working full-time and I was going to school full-time, and it was crazy, but I managed to do it. I was taking 5 classes. My work hours would be from either in the mornings when I don't have class, an 8-hour shift, or I would work about 6 hours at night, and then going to school in between.
Okay. Sounds challenging, but quite an accomplishment. Okay. And then I guess just to wrap things up, what advice would you have for our students today who are interested in potentially becoming medical assistants?
So for me, I think that a medical assistant is a stepping stone into healthcare. Other than being a receptionist, if you want to advance your career, you can go on to either like an LPN or RN, or, be a doctor one day. But a medical assistant, I would say, is, for me, it is a stepping stone to healthcare. It's easy. You're not doing a whole lot. The schooling is not that difficult. Terminology you learn as you go. When I first got into healthcare, I did not know a lot of medical terminology, but as the years go on, you learn that from patient calls and from hearing it from the doctors.
Wonderful. Thank you so much. I can vouch for you, Angelina. I could say that I was an event with Angelina recently where we were partnering together, and as I sat next to her, I mean, she just has a wealth of knowledge in healthcare, which is, comes with the time that she's spent in healthcare and in her role. She has a very, very broad knowledge base of healthcare. So, but thank you so much for sharing your story today. I think it's inspiring for our students.
Mhm.
So in case you haven't had a chance to see in the chat, if you do have any questions for Angelina, feel free to put them in the chat, or if you could unmute yourself and feel free to ask your questions. And looks like Samuel in the chat put, is there additional schooling needing for an MA2 or an MA lead? And what does that look like? Oh, Angelina, if you
So-
want to answer from your experience.
Sure. So with the MA2, depending, for me, there was what they call a ladder. So you have to be certified medical assistant. You have to be current in your role for 2 years, and then you have to have extra responsibilities, engagement with like small committees of the clinic or outside of the clinic. Like this is what I do outside of the clinic is I do an outreach, coordinating jobs with Kim and other coordinators out there. So as kind of like a volunteer, extra responsibilities that I do. So in order for you to move up the ladder to a MA2, you have to meet the qualification. There is quite a few steps for you to do, and you have to apply for a MA2 and be accepted to be a MA2. You do have to renew that title every 2 years.
And I do know one thing at Aurora Healthcare is when you move into a level 2 role, is that you really have to be considered a subject matter expert. And what that means is that you're a resource for others. And that you might also even train others, train new medical assistants as they start in their job, be a resource for them or a preceptor for them.
And it looks like we have one more question asking Angelina, do you work in a specialty area, a specialty position, or in a family care?
So I first started out as a family medicine. I was in that department for about 2 years, and I decided that I wanted to do something a little different. So I had expanded my horizon to neuroscience. So now I am currently a medical assistant lead in the North Market neuroscience department.
And we also have someone asking, can you work with kids? Can you work with children as a medical assistant?
Yes, I did do my internship with children's, pediatric, doing shots, vitals. And so we do have medical assistants in that field as well.
And one of our healthcare partners on today is Children's Wisconsin, which exclusively works with children. So yes, you can be an MA and work with children. And one final question, it looks like, do you have any tips on improving pronouncing medication names?
Medication, there are a lot of different names. Sometimes there are medications that you look at it and you're like, okay, that is for the blood pressure. Or what I do is I use either the brand name or the generic name, whichever one is more easier. But as far as tips, I would say once you get into a department and you are used to seeing the names of the medication, eventually you will be able to pronounce them.
And I would just add that with working in healthcare, you have not only the medications, but there's a lot of acronyms like MA, RN, CNA, BLS, and it's called the acronym alphabet soup. It'll just take time for you to learn them. You're not going to learn it all in one day. There's not going to be an expectation once someone is doing their externship and starting to work in healthcare for you to pronounce them correctly for the medications or to understand all the acronyms. And if you don't know them, just ask. People are happy to help and explain them to people who are new to healthcare. And if you did really want to know and make sure that you pronounce them correctly, you could probably go on YouTube and like AstraZeneca, like you could just say AstraZeneca commercial and then just listen how they're pronouncing it in the commercial. But most of the time, and Angelina, you can correct me if I'm wrong, there's the generic term or name is probably more commonly used. So I just wanted to add that.
Yeah.
DJ, it looks like there's a question that's more specific to children's in the.
So with working at Children's, there isn't any specific qualifications that you would need other than just wanting to or be passionate about wanting to work with kiddos. So there is like at a higher level, at a pediatric level, and some other clinical positions where there may be some extra like certification that they'd be looking for, but at the medical assistant level and other positions, there isn't anything special. Usually what you'll find when you're going to school to become a medical assistant or respiratory therapist or whatever it may be, that children's and pediatrics is considered a specialty. So there'll be like one little module or lesson in your whole entire program where everything's so adult focused. So usually when people do start working at children's or pediatrics for the first time, there's additional training that we do provide. So when you're doing like vitals and weights and measurements, you're practicing and learning on adults. So then you have to learn about working with newborns and children. But there's also the training and support, whether you're advocate, Ascension, or Freighter, you'll still work with pediatrics and kids there as well. Any other questions in the chat, or if somebody wants to unmute themselves to ask Angelina any further questions? And there'll also be questions at the end.
I have a question. Can everybody hear me?
We can hear you.
Yes.
Okay, so I'm currently a youth apprentice at Freighter, a medical assistant youth apprentice, and I was interested in going into being a medical assistant, but also I am enrolled in school for pre-med, and so I was kind of thinking of doing it like part-time and doing night classes or classes towards the end of the night for college. How do you think that would do you think that would be too stressful to balance, or if you kind of get what I'm trying to ask?
So I'm just going to recap what you said and just let me know if I misheard you. So right now you're through Freighter, you're doing a medical assistant apprenticeship. Is that correct?
Yes.
Okay. So with doing that, that would align very closely to this program. So I think you'd continue pursuing that with Freighter, but we'd want to double check with them to make sure I'm not telling you anything incorrect. They weren't one of the presenters here today. They weren't one of the presenters, but we can follow up with them just to clarify. But if you are going to school for pre-med and you have like goals of being a doctor or just any other like degree program, whether it's associates or bachelor's, having the experience as a medical assistant is valuable. So usually once you're applying to like a med school program, they want you to have some form of like healthcare experience. So I know some students will be like a CNA or it's being a little bit more prevalent for people to be working as a medical assistant too, but you also want to have good work-life balance and school balance and still have like a social life and stuff. So you wouldn't want to burn yourself out. But the path that you're on right now with being in that apprenticeship through Freighter is awesome. And then continuing to find a way to work as a medical assistant while you're in school so that you can gain experience and then also still do well in school and have a social life.
Yeah.
So that'd be my response, but others can chime in.
Okay, thank you.
Yeah, I would have to echo what you said exactly, DJ. I mean, and I think it does depend on the person. You know, everybody's different as to what they can balance in their life. So you have to know yourself and you know, think about your priorities and what's going to be most important to you you know, in this time of life, and it'll you know, you'll have to put some thought into it. But yeah, as DJ said, just continuing to gain more medical experience is always an asset.
You know, I'd have to echo on both of that because one, it is experience. This actually answers the question of how do you get better at pronouncing medications. Say it a lot, say you hear it correctly, so you say it correctly. And that's the same thing. And if you have a career pathway in healthcare that you want to pursue, that's a great way to start experiencing it. I know a lot of physicians who went to medical school with the intent of being a surgeon or a pediatrician who fell in love with another discipline of care when they got into it. Same thing with nurses. So the experience and the exposure is what's really key. As far as what's stressful for you, that's an internal question. You know, and you make sure you take on what you can take on smartly and be successful with. With that, I think it's a great time to talk a little bit about why we should work in healthcare and why we could work in healthcare, which is one of the reasons everyone is on. So we have the presentation that will be shared and there's great work, but one, it's so fulfilling, right? So when we look at the MA pathway, the question is one, is it a entrance pathway into a long and you know, detailed healthcare career? Or is this the job you want? Because both of those answers are absolutely okay, because there are plenty of people who have long careers as an MA, and MA is a career, right? We talk about why we work in healthcare and what we have, you know, so again, there's a great salary. One more thing that we talk about, we say healthcare careers, but we have to remember healthcare is a calling, right? We are called to come and serve others, and it doesn't matter which system we work in, which population we want to work with. You know, we love kiddos. There's a lot of people I know, my nieces especially right now, who are in nursing school, who had an idea of being ER, trauma, all this cool stuff, and fell in love with kids and fell in love with babies. So, and that's just where their pathway took them. So looking at that calling, which draws us to take care of people, and then all those benefits we have, again, being a medical assistant, especially having the opportunity to train out into high school and be certified so early, it's a great career and a great salary coming into that. And there's strong job security. Healthcare is not going anywhere. As Angelina said, you know, this is a face-to-face healthcare environment in medical assisting. So we're interacting with patients, we're working with our physicians, with the doctors, the nurses, the physician's assistants, the NPs. This is a hands-on career that is awesome. The demand for this is huge throughout, not just in Wisconsin, but throughout the US. And it's a great job for a long term. It's also a great entry point, and it's stimulating. And working, especially in primary care or in office space, you start to develop relationships and establish rapport and get your own group of patients as you're working with the providers you work with. So it's a really great, meaningful, stimulating, rewarding environment. I think this continued on the next slide. Yep. And variety. I know I saw some of these come up, and I know there are some more conversations in detail on this, but we have a variety of opportunities, again, at all levels, from working with a high school diploma through completing a doctorate or a medical degree. Every opportunity is there. And I know all of our systems have great internal associate enhancement programs, and that's a big part of what we do and why we're here. So those opportunities are out. In medical assisting, it's flexible, right? You can pretty much find any schedule that works for you or any clinic based on the system, the clinic that you want to work in. Healthcare is 24/7. Again, it's not going away. We have medical assistant opportunities everywhere. We talked about the scholarships and tuition reimbursement and tuition support programs that we have to help us grow, because there's nothing more we want to do is when we bring you into our systems is to see you grow and flourish. And maybe we can add this to a slide later, but I know there's a lot of memes that go around with plenty of nurses that have multiple job badges on, and that's amazing. You see somebody who started as a high school volunteer or as an MA or a CNA who then is a CNO somewhere. And actually one of the CNOs I worked with years ago actually started that way, had a 40-year career within the VA and started as a nursing aide and retired as a PhD nurse where 90% of her education was funded for her. So those programs are there. And again, it comes to why and what is healthcare. It's about people. It's you have to be a people person. You have to be a team player. So what's going to make you successful in healthcare, which is the next slide. So we talked about that calling and being compassionate towards others, being patient-facing, customer service, patient service, and experience orientated. So, and we don't just say customer like we think about being in a restaurant, but we want to look at how we're interacting with our patients and their families and their caregivers and everybody that's there with them, as we're really partners in care and how we provide. And we call it healthcare for a reason. Everybody thinks about sick care, but when we're working in clinics, it really is our ultimate total healthcare and our team approach to our patients and their families. Again, we talk being flexible, right? Healthcare is a science, but it's an applied science. It's always changing. That goes right into being a lifelong learner. Being a medical assistant, and Angelina said this, is it's something you need to learn. Doctors don't just finish medical school and never study again. Nurses the same way. We all have continuing education. It's ever evolving, ever changing. So it's amazing. And then, being dependable, because we do have people who depend on us. We have coworkers who depend on us, and we're going to show up, and we're showing up for the people we're working with and for those patients we're caring for. We really do consider caring for patients a privilege, right? It's a privilege. It's not just a job. That's why it's a calling. So, we love it. I know the people on our side of the phone love it. And even though we work for different systems, we work together, and we do it because we want to see the healthcare workforce grow with great people, which is why we appreciate you all taking your time tonight to be on the call. I think with that, I can turn it over to you, DJ.
Thanks, Michael. So if you could go to the next slide, please. So when you complete this program and graduate from high school and start your externship and become a medical assistant, there's various places that you can work. On the screen on the right-hand side, you'll see Children's Hospital on the right-hand side, and then there is in the middle our new clinics building, and then on the left is our emergency department. So this is a great picture to show a couple of the options, but when people think healthcare, they usually think hospitals. But here on the slide, I talk about first primary care clinic, where you're going to see your doctor or your provider to be able to get help for like common illnesses, things like flu, mono, strep, get your immunizations. And then urgent care is going to be when your primary care isn't available. So primary care is usually Monday through Friday. Urgent care is going to be generally evenings and weekends, or when you just need to see your doctor right away, and you can't wait a week or two to see them. And specialty care, this is going to be more narrow in scope, where you're treating a specific illness or a specific area of patient care. So some examples I list here is like dermatology, working with skin, asthma, allergy, GI, neurology, so different parts of the body and some form of specialty. And then the last one, which is probably a little bit more newer for medical assistants to work in, would be the emergency department. So this is your department that's open 24/7 and working with like trauma, car crashes, gunshot wounds. And you'd be working as an emergency department tech, or they may be titled something differently, but there is a wide variety of areas that you can work in, but it's most common for medical assistants to work in clinics during the daytime. So here on the next slide, just talking about work schedules. So usually it's called like banker's hours, where you're Monday through Friday. As Angelina mentioned, usually some doctors can start at 7, 7:30, 8 o'clock, but most common 8 o'clock. And then it'll usually go till like 4:30 or 5, but some do have some extended hours to 5:30 p.m. And it's important to know that if your schedule's like 4:30 is an end time, it just really matters when that last patient is done being seen. So if somebody does arrive late for their appointment, or they're a talker, sometimes it can go a little bit longer, but it's usually just doing 8-hour shifts. But there are some other types of work schedules where you're just doing evenings and weekends, or weekend only, or there's some 4 or 12-hour shifts. And then there's some potential for hybrid work possibilities. But here on the screen here, I have one of the freighter clinics. So driving throughout your communities, you probably see all these different types of clinics throughout your community. And it's not the large hospitals, it's your standard clinics for like primary care, specialty care, or urgent care. Next slide, please.
It's a question in the chat.
Oh, is the emergency department what MAs typically do? So the emergency department medical assistant is new to children's. We've only had medical assistants starting to work there in the past year. Some of the other healthcare systems are looking into having medical assistants working there, but it's a new kind of space that is where you will see more and more medical assistants starting to work there. So I just want to make sure I answered all that question there. Look at the chat. And then,
Hey, DJ, if I can add to that quickly. I know we do have some medical assistants in our emergency departments, and this really comes back to your career pathway as the individual. So perhaps the medical assistant or ED tech that's working there, or patient care tech, depending on the title, maybe somebody who's looking more towards an EMS role. We do see a lot of that, where there's the interest, and they may also be an EMT or an EMT going through paramedic training, and that's the career path that they're looking to take on. We've seen that as kind of an earlier first step.
And when people become a medical assistant, one of the more common pathways is someone will go on to become a registered nurse. They could even go and become a nurse practitioner, but it's not always just a straight up career ladder. You could become a respiratory therapist. You could become a surgical tech. There's so many other different pathways that you can take. But by becoming a medical assistant, it's a well-paying job, and you're starting to work with nurses, doctors, patients, and families. So like this is a really great program as a high school student for all of you to be considering. And here for the last slide of the presentation, just wanted to comment, and we've already been talking about this, but as a medical assistant, the largest patient population is the adult space, so anybody over the age of 18. So when you're working at Advocate, Aurora, Assumption, and Freighter, you'll see both adult patients and pediatric and children patients. But at Children's, we only see pediatric patients. There are a small case of people that we do see over the age of 18 because of some like rare heart conditions and things that they have. But for the most part, Children's is a specialty focused on pediatric patients. So just wanted to call that out so that all of you can start thinking about that if you had a preference between the two. And then also just know that if you start off in adults, you can go to pediatrics or to Children's, or if you start at Children's, you could always go to the adult space. So it's not like once you choose one or the other, you're locked in for the rest of your career. So I'll wrap up the presentation, just open it up to questions, and see if anybody has any questions they want to put in the chat or unmute themselves. And then Tim, Michael, or Angelina, if you want to add anything else.
So with medical assistants, you see more medical assistants work in clinic versus in hospitals. In hospitals, you see more of CNAs. They're working along the bedsides with the patients. But with medical assistants, we work more in a clinic setting with appointments versus overnight or being with that patient for a long period of time.
I'd have to add too that when working as a medical assistant, you might be the one to help a patient feel calm if they're nervous. You might be the one to, just ease their mind, and also to, at the same time, you're there to make things easier for the physician too, the physician or the nurse practitioner. You're preparing the patient to meet with the physician and to just overall make that a real smooth transition for the patient and the physician together. And really that medical assistant is often the face of the organization. When you walk into a clinic, you go and you check in, you sit down, and you wait for someone to come out and get you. And oftentimes it's that medical assistant that's greeting you with a smile, asking you how your day is, and then beginning the conversation by talking to you about your concerns and why you're there. I think about my own daughter, and for years, I mean, she's a teenager now, but that's who she remembers when she goes for her appointments throughout her whole childhood. She remembers that medical assistant that she loves. And oftentimes the patient is, depending on what the appointment is for, sometimes they're spending just as much time with the medical assistant as they are with the physician.
Ivana had a question.
Yeah, I did have a question. So, like, I know I want to work in with trauma, or like in the trauma department, or like I know I want to work with like very intense stuff. But like I was wondering, is there any departments or roles you guys suggest?
So the question was just any departments that we would suggest?
Yes, for like working with like trauma or like deeper stuff. Like I don't know how to like more
So
intense stuff.
there's the urgent care and the emergency department are going to provide someone with the most amount of like trauma experience. So car crashes, gunshot wounds for emergency department, then urgent care, like minor, I mean, I shouldn't say minor, but things that don't need to go to the emergency department, but should go to urgent care. However, once someone completes this specific high school training program, it would be best recommended for them to start off in primary care or specialty care. Usually someone would need to have some experience under their belt before they start going to the trauma-focused areas. And it really depends on like the person, how fast they pick up on things, but most medical assistants who haven't had any form of healthcare experience will fall into primary care or specialty care and then transition to those more trauma-focused areas down the road. It's not to say that it isn't possible for someone to go straight to those, but usually our leaders that are hiring people would like to see someone with some form of experience just because of the level of seriousness and fast-paced nature that you'll find in those trauma areas.
A great question.
So next,
was a-
go ahead. So next steps, for those of you that already submitted your applications, the next steps will come to you via email. So it's really important for you to check the email, the one that you used when you applied, because you'll be getting additional information via email. And if you haven't applied yet, in the chat, we put the link to the webpage that has more information and has the application. So we encourage you to apply, but apply quickly because things will start to move rather fast to be able to start this program in January. And I see Ivana, you raised your hand.
Yes, I also had another question. So I heard, so you guys just mentioned that the program start in January. So like, how long is the program?
It is 1 semester in length. It's half days for 1 semester. So it starts in January right after your winter break, and it would end at graduation. And then clinicals would start right after graduation. So you would take your certification test that last week of school, and then you move on to clinicals, which means you're being placed at one of the hospital systems and you're doing your clinical practicum experience for the 4 to 6 weeks of clinicals. And if you successfully complete all of that, you are then eligible to begin work as a medical assistant.
And I would just like to add for the students that are interested in pursuing this program and you've submitted your application, the instructions for completing the next step of a recorded interview will allow you to complete the interview on a smart device, so cell phone, tablet, or on a computer, whatever your preference is. You'll record yourself just answering a couple brief questions just so that we can learn a little bit more about you, so that we can review that information for our selection process. It is going to be time sensitive, so as I was shared a moment ago, that keep an eye out on your emails and the instructions. And if you do have questions, to respond to that email so that we can help you out. With using technology, obviously you want to make sure everything works smoothly. So if we're running technology issues and we're not trying to give you all an anxiety attack having to record yourself, you'll be able to watch your responses, re-record them if you want to. But just some basic questions to help learn a little bit more about you. Then there's a question in the chat, just is there a certain amount of people that get selected? So Kathy or Jen, do you want to answer that one?
Yes, because this is grant funded, there isn't room for everyone that might apply. So we're anticipating 18 students between 2 different class locations. The locations of the classrooms, we have South Division High School will have a classroom, and the Deer Creek Intermediate School in St. Francis will have a classroom, and we'll have room for between 16 and 20 students between the 2. So that's why we're doing interviews, and we want you to put your best foot forward. And there will be a selection process between Center for Healthcare Careers and our hospital systems that will be reviewing the applications and selecting individuals that we feel would benefit the most from this project. And there's also a question that says, is it in person or virtual? I'm assuming you mean the class. The class is in person, so it's half days every day of the week, and the class is in person. So you'd be getting lecture and lab and hands-on activities. You'll be learning how to do blood pressure. One important thing that we want you all to know is one of the roles of a medical assistant is giving injections and drawing blood, doing phlebotomy skills. At first, we practice on mannequins, but in order to train you to be comfortable when you get into a clinic, you'll be practicing on each other. So if you are squeamish about giving or getting injections or needles, that's something you might want to have a conversation with yourself about to see if this is something you'd be comfortable with.
Are there any other questions? Somebody
just-
wants to know what clinicals are.
So
Oh, go ahead, DJ.
sorry about that. So with the clinicals, you'll be at one of the 4 systems it'd either be Children's, Advocate Aurora, or Ascension. And you'll be at a clinical site where you'll have a preceptor, which is in most cases probably going to be a medical assistant and maybe an RN, but most cases will be a medical assistant. And there'll be a list of competencies and skills that a medical assistant does. They'll train you on how to do that, and then you'll start to perform those tasks after you feel confident and are working with your preceptor to be trained in those different type of skills. So it's a minimum requirement of 160 hours. So if you're working full time, that usually is about 4 weeks. But with the clinical experience, it's your opportunity to learn. You're taking everything from the class in the lab to start using those skills in person and learning firsthand what it's like to be a medical assistant.
And that's actually in the summer after you graduate high school.
I see one other question. Would the high school students who are currently in youth apprenticeship at Freighter still need to do externship? And that is a question we do not have an answer for because we didn't know you were all out there until today. So that will be something that we would consult with Freighter on, find out how much experience you've had in your youth apprenticeship, how much you've learned, to see if there would be any additional practicum that you would need.